Yesterday was an incredible day. We had hundreds of people come out on an incredibly cold day. Wind chill factors were -30 in Vermont yesterday. And, we started off the day right down the street from the State House in a church. We had a People's State of the State address, a speak out, where, the Healthcare is a Human Right campaign was joined by folks from immigrant right organizations, climate justice organizations, disability rights organizations, unions, incredibly broad range of folks to talk about, a vision forward, which including, obviously focusing on universal health care, but how that is also connected to actually all of our human rights and having, kind of democracy and economy that works for all the people. And then we marched down to the State House, through these cold temperatures and ended up, packing the State House before the State of the State address, as you said, around singing and ended up, being there basically for many hours throughout the day.
And James, what about the governor's claim that the taxes required to be raised would be far too onerous for the citizens of Vermont in terms of implementing single payer? What's your response?
Something like 11% on payroll, 9% on income tax.
Well, yeah, they just released a report, and the law that we passed in 2011 required the governor to develop a proposal of how to finance it. And it was actually due 2 years ago as part of the law that we passed in 2011. And, he waited until after the election. He said he had to, wait to make sure he got it right. And his job was to come forth with a proposal that then the legislature would determine whether we could do or not. And instead of doing that, he said that, this is the best he could do, but he thinks that Vermont can't afford it. We've spent the last few days, and others have, including a lot of economists, who have dug into the report. Some really good work was done in there, and it actually shows that Vermont can do this, that it actually benefits the majority of people, but it would require us raising taxes on keeping high levels of taxes on large corporations and on wealthy folks. And that was a political choice that he said that we couldn't afford. And what we say is we can't afford the current system. It's a crisis in our communities, and we have to keep moving forward.
And to state legislators who supported single payer said you hurt the cause by sitting in and disrupting the inauguration?
Well, we are coming to say, yesterday and all the days that come that we need to, that, we are not going to stop. We've come way too far. We're not turning back. Vermont has passed a law saying that health care is a public good and that they have a job to take up this financing report.